It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to today's episode of Morton in the Morning. I'm your host, Julie, and we are coming to you right here from Morton Hospital, your community hospital right here in Taunton, Massachusetts. Thanks for joining us, and we should also say happy summer. We hope everyone is enjoying the nice weather that is finally here. We have been playing some new shows for you over the last few weeks. We hope you've enjoyed those, but if you did miss any of those shows, don't worry, you can still listen online. We post all of our shows to our Facebook page. You can find those at facebook.com/Morton Hospital MA, and just scroll down our page and you'll see the weekly shows with a link to listen on YouTube. So go back if you didn't hear any of our recent shows, which included a show about our open careers here at Morton Hospital, a show about the importance of sleep for your health, and also a show about summer wound care and wound and injury prevention. So again, check us out on Facebook if you missed any of those shows, and you can hear them online. But we hope you are coming in and listening to us live, every Wednesday at 11 a.m. right here on WVBF. We have another great show lined up for you today, so let's get started. So we have a special guest today. His name is Najum Zadie. He is the Director of Infectious Diseases here at Morton Hospital. He practices here within the hospital and has an office in our Thayer building, which everyone is very familiar with. So welcome, Dr. Zadie.
Hi.
So we have a great topic today. Hopefully our listeners agree. We're going to provide a lot of information about tick season. But before we do, we want to, of course, get to know you a little bit better. So tell us about yourself and your background.
I'm an infectious disease physician. My family originates in Pakistan. I'm an immigrant. I came to the U.S. in 1999, and I was always interested in infectious disease. Mm-hmm. The burden of disease is mostly infectious, and where I come from, there's a lot of tuberculosis. Mm-hmm. There's a lot of illnesses that are puzzling. Tick-borne disease is one of them. So I was very interested in this very early. After medical school, I was in the field of epidemiology, which is closely connected with infectious disease. So It was a natural to go into infectious diseases.
Okay. And now when you say epidemiology, that is the origination of diseases?
So epidemiology is the study of the spread of disease or practices or something that affects human beings and how it occurs, what causes it to occur, where it occurs, who it occurs in. So it could be applied to infectious diseases. It could be applied to cardiac disease or high blood pressure, diabetes. So it's a study of how humans interact with disease.
Okay.
Yeah.
Great. So what are some of the more common infectious diseases that you see here in the hospital or maybe treat within your outpatient office?
Well, believe it or not, tick-borne illness is one of the most common diseases here in this area, which is sort of believable. I just didn't realize that a place like Morton Hospital in Taunton would have a lot of this. My original, I've been in Rhode Island and Massachusetts and adjacent Connecticut areas for many years, and I have experienced there are places where there's very high prevalence of tick-borne illness, especially the Cape and Islands. And anything that is adjacent to the Cape and Islands has a higher prevalence. There's a lot of areas that are landlocked, but they have a lot of deer population, wild animals, and that causes ticks to stick around.
Okay.
And there are areas in Morton that have a high tick prevalence. Other diseases that I look at in the hospital, there is a lot of high blood pressure and diabetes here, and that leads to a lot of illnesses with infections of the skin, pneumonias, and obviously the big one in the last few years has been COVID and viral illness.
Yeah, I mean, I was going to bring that up. I'm sure you had a lot of involvement with COVID here in the hospital, but I'm glad that we are sort of talking about, tick season, because with COVID, that has sort of taken precedent over so many different things. But people really need to be mindful of all of these other risks to their health as well.
Yeah, and in fact, frankly speaking, I have seen tick disease for many years, but even I was fooled because it presents very similar to how COVID presents sometimes with fevers. So
interesting, very interesting. So let's start to talk about tick season. So is like the flu, is there a season where it's typically labeled tick season?
It is traditionally labeled tick season around spring and then deep into summer. Having said that, things change, and there's a lot of environmental things going around. There's more warmth, there's longer summers, and it seems to be that it's stretching more and more. I used to not see tick-borne illness in the deep winter, but now I see occasional tick-borne and tick-bite disease. I see people who rake leaves and ticks are sticking around, so they get tick-borne illness in the middle of winter, but it's rare. Mostly starts with spring, thaw, and then the ticks come out and start biting, and then it spreads into summer, and you can see it late into summer when there's warmth. Around when the cold spell comes in, the ticks sort of hibernate, and so the prevalence of tick-borne illness goes down.
So they hibernate, they don't, die when
a lot die, a lot hibernate, yeah.
Okay.
They have a life cycle.
All right. And so you had mentioned earlier a couple different types of ticks. Are there different types that actually cause health issues in humans?
There are, but some more than others, and some that are more studied than others. So the common tick that is quite prevalent in this area is the deer tick. It's like a little tiny tick that in the adult it looks a little red. People here recognize it. They recognize it better than sometimes I do. They bring in crushed pieces of it that they've picked off, and so that's the common one. That carries Lyme disease. It carries a disease called anaplasmosis and another disease called babesiosis, and I can get into that. So ticks are quite common. There are other common ticks that you can pick off your dog that don't cause as many diseases, or not that we know of. So the dog tick, there's a wood tick. And then there is recently there has been sightings of the Lone Star tick, which is very recognizable, and it is becoming more prevalent in these areas.
Okay, so the deer tick is the biggest one that we need to be concerned about, and you said that has like a reddish tint to it.
At the bottom half of it, and the legs are black, and the front is black, and it's quite prominent. It's easy to recognize.
Okay, and what is it in these ticks that is dangerous? Do they have some sort of a venom or poison when they bite you?
So they do have like venoms and things that will have them stick around and suck blood and numb the area. But predominantly they are great hosts for these bacterial and parasitic illnesses that are in their gut, and as they feed on human beings, these travel from the tick stomach to the mouth and into the human blood.
Okay. So if you are just joining us, today on our Morton in the Morning show, we are sitting here with Dr. Najum Zadie. He is an infectious disease specialist here with our Steward Medical Group practice in the Thayer building at Morton Hospital. And we are talking all about ticks and tick season and learning about why these ticks can be such a hazard to our health and what some of those illnesses can be if we are actually bit by a tick. So we have a lot of great information to cover. I have tons of questions. I think this is such a great topic that's really important to our community and to our area that can affect people of all ages. So we have more with Dr. Zadie to come. Before we do, though, we do have to take our first break of today's show. So stay with us. We're going to take a quick break, but when we come back, we'll be back with more with Dr. Zadie, talking about tick season and what you can do to best prevent tick bites and avoid some of those tick-borne illnesses that we often hear about. So before we break, just a reminder how you can contact us here at Morton in the Morning. You can email us anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. That's our email address. We check that regularly. And you can send us pretty much anything, any feedback about our shows, any follow-up questions, or if you have a topic that you'd like to hear about on one of our future shows, we would love to hear your suggestions because, of course, we want to, feature topics that our community is interested in. So, again, we hope you're enjoying today's show. And when we come back, we'll be talking more about tick season and tick-borne illness prevention with Dr. Zadie of our SMG Infectious Disease team. So stick around. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. Thanks for joining us for today's show. I'm really excited about our topic today because I think it's such a great and interesting topic that pretty much could impact anyone out there. So we're talking about ticks and tick season and some of the diseases that ticks can carry that can affect humans. And our special guest today is Dr. Najum Zadie. He is the Infectious Disease Specialist here at Morton Hospital. He does amazing work, and he's super knowledgeable on this topic. So we are so happy to be sitting here with him today. And before we took our break, we were learning basically about, tick season, when it runs traditionally, and also, what are some of those ticks that we really need to watch out for. One being the deer tick, of course, that can carry most of these illnesses. And Dr. Zadie was telling us a little bit about the venom or the poisons that are inside the ticks that actually cause these problems for us. So let's talk about the effects of a tick bite, with those dangerous ticks. What are some of the short-term effects that you might notice?
Well, you might notice a little scar in the area, redness that might stick around. You might scratch at it, it might become red. That is the immediate effect. Some could have, it might be like a bee sting. You might have a reaction to it. Mm-hmm. So insect bite itself can cause quite a bit of irritation.
Okay. Now, you often hear people refer to like a bullseye-looking design on your skin. Does that happen always?
Yeah, no, it doesn't happen always. But if you get Lyme disease from a tick bite, and that takes quite a bit of doing. Well, there is Lyme disease causing organism is in the tick stomach. If the tick bites you, it slowly feeds on you over 3 days. Blood that is your blood going into the tick stomach, churning up the organism, making it wake up and get into your body, takes about a couple of days. And if you get that into your body, this red rash is the organism invading your skin and spreading to the rest of your body. So that takes maybe about 10 to 14 days to start developing. Can happen as early as 3 days after the tick bite, but usually generally around 10 days.
Okay, so
and
that
is
been there for a
distinctive.
while.
Yeah, that's the tick has been there for at least 2 or 3 days, and then after it's fallen off, it's taken a couple of days for this to occur.
So again, that emphasizes the importance, obviously, of thinking about this. Being aware of checking your skin, especially if you're out in the woods and everything. Now,
I think people in this area are quite experts at doing that, but sometimes things happen. You don't notice, or your spouse is away, because usually, if they're in the back of your neck and stuff, it's usually your spouse or family or a mother or a child noticing it.
Okay. So we talked a little bit about, the short-term effects, what you might notice, and I was going to ask about the long-term effects, but I'm assuming that leads into the discussion about some of the more prevalent diseases like the Lyme, and that you had mentioned another one earlier as well.
Yeah. So it takes maybe about a day to transmit the other ones, Anaplasma and Babesia, and so each one of them is slightly different, mostly treated by the same drugs, but I can get into this. So Lyme disease is the most feared. Now, Lyme generally does not kill. There are people who die from Lyme disease, and it's rare. Usually, especially these days, we can catch it pretty fast and treat it. Even if we didn't, I think that there is resistance to it, like people can maybe clear it from their body on their own. And when that doesn't happen and they're not feeling great, that's when they seek medical help. And we can usually treat most of them so they don't die, almost always. There have been cases of very young people having Lyme disease where it attacked the heart tissue and they didn't get to a doctor in time or get a drug in time. And then that led to like the heart not behaving well and them having an arrhythmia and dying. But in general, Lyme can be treated in these stages. The problem with Lyme is, and we've discovered with COVID as well, is that it activates the immune response. And treating the disease doesn't stop the immune response. So sometimes we treat the disease, the Lyme is out of your body, but the immune effects, the fatigue, the sometimes aches and pains, forgetfulness, brain fog, things like that, they may linger. And that has led to this thing, they feel people feeling that they still have Lyme disease when they don't.
I think that's a common, misconception is that once you have Lyme disease, you always have Lyme disease.
No, that is not the case.
Yeah.
That is not the case. But the immune consequences of it may stick around for a few years, fatigue, etc. So that's what has led to this. But the treatment is still a few days of antibiotics.
Okay, and it can go away altogether.
It can go away altogether, but as we found out with COVID, and COVID has been very. It explains a lot of things about our immune response, and COVID has a really active immune response, and that can linger. So what we've now thought about Lyme disease like that, and other diseases like that, where sometimes we think that we should be completely better, and we are not. And even though the bacteria that causes it is dead, the immune response, that is our own body attacking, that doesn't stop, and sometimes that takes a little bit of doing to get over that.
Yeah, I know, as of recently, or, you've heard the term, I believe it's long COVID, which, again, reiterates those long-term side effects that you might still experience, but they might go away. So similar concept. Yes,
similar concept, except that what has happened over the years is there's a huge mistrust between doctors and patients, and there has been an industry that has sprung up with Lyme disease and the chronic symptoms. And there are charlatans, there are people around who want to exploit that. And if you give money to somebody and you say to them, treat me and I'm not feeling well, they'll find ways to treat you. And so there have been people who have treated this disease long term with antibiotics, and that's caused a lot of complications and consternation.
Okay. So Lyme disease is probably the most common. Are there any other diseases that can be caused by tick bites?
Yeah, sadly. So they're funny ones. You may not have heard of the name, but you might have suffered for it, or you might have thought you had Lyme disease, but it was this disease. So one of them is called anaplasmosis. Anaplasmosis is a bit like Rocky Mountain spotted fever, which is, again, people haven't had it. It's more achy. It's more severe initially. It has higher fevers. If you do blood work on these patients, they have abnormal blood work, but they tend to get better on their own, but it could be quite severe. So it could cause really severe joint aches and pains.
Okay.
It can sometimes cause a rash, not like the Lyme rash, but like a spotty rash all over the body. And so it's there, anaplasmosis. It can get quite serious, make you quite ill, but generally people get over it, and it requires almost the same antibiotics that are used for Lyme disease. And usually it hides with Lyme disease. So we're treating Lyme disease, we were actually treating anaplasmosis. In fact, somebody did a study on the Cape and Islands to find if a person who got bitten by a tick got which disease, and they found out some people, 15% of them, in fact, about 1 out of 10, more than 1 out of 10, got all three.
Oh, wow.
Yeah, so there's possibility that you could have 2 diseases or 3 diseases with the tick. Another interesting one that we've recently been finding out is the alpha-gal syndrome, which is interesting, which is not much to do with bacteria, but the fact that what the tick saliva has. And what happens with that is that the tick mouth secretions, which usually tend to numb us up or make the blood flow so that the tick can feed on us, can evoke an antibody response against this protein segment called galactomannan. It's called alpha-galactomannan, and these people who have antibodies to this protein tend to become very nauseous with meat products. So it's a meat allergy. In fact, not only nauseous, they can have full-blown allergy, or called anaphylaxis, which is like a swelling of the face and tongue and a rash and a collapse. And it's called alpha-gal syndrome, and we're finding more and more about it. It's a food allergy to meat, set off by the tick bite. And which tick? It's the same tick. So
okay,
yeah,
that is really interesting.
It is cool.
Now, Are these poisons always in this tick, or does something happen with the tick? Does it come in contact with something?
Ticks, some of them are within the tick. It needs them to feed on us. Some of them, because they belong to the tick and they're proteins that are foreign to us, we build antibodies to them. That's one thing. Another theory, which this is more true, but another theory is the tick themselves get diseases, and some of them can affect the ticks and make them behave erratically, and that can lead to it's a whole new chapter of how to study disease. But this alpha gal seems to be something that the ticks have in their body, a protein that we react against.
It seems as something like this is such an evolving field of medicine, because things change, diseases change over time. Infectious diseases, as you've seen, COVID, it mutates.
Well, Lyme has been around for thousands of years, but the United States version of Lyme disease was sort of 1978, when people around here in Lyme, Connecticut, started realizing, hey, my child is ill with something, and doctors are telling me, oh, it's some kind of joint disease or immune disease, but I think it's something else. I think it's a tick or something. And frankly speaking, the suspicions of these people that the doctors were wrong and they are right about their children led to this whole discovery of Lyme disease in the United States. It was a collaboration. Their suspicion and looking after their kids, the doctor's suspicion that the moms who thought their kids were sick with something else, and then interestingly, investigation into it, finding old journal articles from Europe saying, oh, this is Lyme disease. So they not Lyme disease, but it was called something else, but that this is the same disease. And it's kind of interesting, but that led to this whole mistrust has lingered. So a lot of people don't believe their doctors about Lyme disease, that it can be treated with short courses of antibiotics and stuff. And there's a lot of misunderstanding around it with the medical profession. Interestingly, when you were asking why I got into infectious disease, at age 14 or 15, I picked up this scientific magazine, and it talked about 3 different things, which were all interesting. And one of them was Lyme disease, how it's transmitted. The second one was the Cape and Islands and sign language in the Cape and Islands. And I was so fascinated. I never thought that I would eventually work in an area which has all of those things that interested me in a scientific magazine.
Absolutely. Yeah. Now, does Lyme disease, does it present differently in adults than it does in children?
Slightly. I mean, children, I tend to notice, are a little shorter, so they have the ticks bite them around their ears and things like that, and so then kids kind of roll around more in leaves and stuff. So imagine, if you're looking at all of this, who gets Lyme the most in the United States? And it turns out it's little boys.
Interesting.
Yeah.
Probably they're more active, a little more rebellious, getting into...
Yeah. Things are changing these days, but it has been traditionally little boys.
Okay. Yeah. And are the symptoms the same in children?
The symptoms could be more towards headaches. The rashes are more noticeable in kids because they tend to have lighter skin and things. Yeah. And they tend to be bathed more by parents. So I think that's the whole. But they get fevers and disease very similar to the adults. But I think it's noticed more in kids.
Okay. Now you touched upon it a bit earlier, but talking about pets. So do we not need to worry about ticks on pets at all?
No, we need to worry about them at all. As an infectious disease physician who is an epidemiologist, I find that people with pets tend to get more tick bites, and I think the reason is that the animals may not be properly treated for ticks. You may not be able to find the ticks, or you may not groom your animal as much. And some cats, even though they're indoor cats, slip out, and if they go roll around in the grass, they pick up the tinier ticks, and they bring them in, and they tend to cuddle. Dogs tend to cuddle. They climb into bed with you, so they deposit this magnified, multiple ticks into your bed and your life. And these ticks, any host is good, and they tend to bite the humans the animal is associated with. So people with ticks, people with pets tend to get more ticks.
Okay. And are the pets, so the pets are obviously could be carriers. Yeah. That's a terrible thought. Hopefully we all start to pay attention to our pets, check our pets. Yeah. But are the pets immune to these types of diseases, or can they get these types of diseases?
Pets can get other kinds of diseases, and frankly, I don't think dogs get Lyme disease, they don't have the same immunity.
Yeah.
But they can get a tiny rash, which is similar. They do get, I think you can get a vaccine for dogs, but you can't get so dogs do get Lyme disease. I think there's a vaccine against them. They do get the skin issues. I don't know whether they get the long-term and joint issues or not. I am not a veterinarian.
Okay.
I should have read up.
Well, maybe that's another thing you could explore, but it sounds like you're pretty busy already trying to figure out all these other diseases. So this is also interesting to me, and I hate to do this, but it is time for another break. So we are going to take another short break, but we will be right back, and Dr. Zadie isn't going anywhere because I have a few more questions for him, and we're going to continue to talk about ticks and tick season. So stay tuned. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's Morton in the Morning show. I'm your host, Julie, and we're coming to you right here from Morton Hospital. We have an awesome show lined up for you today. We have been sitting here with Dr. Najum Zadie, the Director of Infectious Diseases here at Morton Hospital, and we're talking about the topic of ticks. I know it's something we never really want to think about, but it's something we definitely need to pay attention for because it is tick season right now, and as Dr. Zadie has mentioned, tick season is sometimes lasting longer than usual. It's starting earlier, it's ending later, but we're right in the middle of it, especially with this warm weather. And before we took a break, we were talking with Dr. Zadie about the different types of ticks, which are the most dangerous in terms of causing illnesses for humans, and those, of course, are the deer tick. And we also were learning about some of the short-term and long-term effects of a tick bite, which, of course, depending on how long the tick has been in you and if it's been infected, are things like Lyme disease, which is the most common that Dr. Zadie was talking about. And also learning some interesting tips, about checking your pets, because your pets can be carriers for ticks, and they can be hiding on your pet somewhere. So if you have pets, they're outside running around in the brush in the woods, you want to make sure to check your pets as well, so that those ticks that might be on your pets don't attach to you or don't get in your, your furniture, on your clothing, etc. Let's talk about prevention. So what are some tips on avoiding tick bites?
Again, this is something my patients know more than me. And then when I tell them, it's like I'm just organizing their thoughts. So obviously, if you are going to spend some time in the woods, you got to come prepared. The socks have to be rolled over your trousers so that they don't slip into your trousers and into your body. They climb up and bite. That's one. So don't let them get access. Sure. Don't go deep into the woods. Brush your clothes. Take a shower after you come inside working in the woods, because that will wash off most of the ticks before they can attach themselves. Look for ticks. That's another one, in good light, hopefully with a parent or a partner. Look for the ticks. Avoid them. There are many ways of avoiding them. One of them is brushing clothes, lighter clothes, watching, and not going into deep woods and deep areas, or at least being careful there. Interestingly, they're chemical deterrents. There's a chrysanthemum derived product called permethrin. Now, it sounds like a chemical, but in generally, it's actually pretty safe. It can be sprayed on clothes. If you're going deep into the woods, you could spray this on your clothes. What I did with my kids' clothes when they were going camping was I put them on the ground, I sprayed the front, the back, and then I turned the clothes inside out because I'm careful, and I sprayed that area too. And then this is a pretty robust chemical. It can survive 2 2 or 3 washes, maybe 6 washes, up to 6 washes, so it can stay in your summer clothes. And it's a pretty good deterrent. That's one. If you're really, really out there and can't avoid them, then treat your skin, and that could be treated with the oily DEET, which is the high concentration DEET. This is available in most stores, sports stores. In permethrin is also available in stores. Permethrin coated clothing is available that is permanent. So there's lots of ways to have these things on your body. You could have a whole body shield. You could have permethrin on the clothes, and on your skin areas you could have the heavy duty DEET. It's a bit oily, but it sticks around for a whole day, and you can avoid mosquitoes and ticks.
Okay.
Yeah.
Now, where are these ticks hiding out in nature? Are they on the ground? Are they in leaves? Are they in bushes?
All of the above.
Okay.
The ticks crawl around, but one of the coolest, it's cool for the ticks, I guess. They do, and all of them do. So when these little ticks come out of their eggs, they don't have Lyme disease in them, but they feed on small mice.
Okay.
Yeah, and from the mice they pick up the baby, all of these pathogens, especially the Lyme pathogen, and now these tiny ticks, which are not the adults, they're not the red-looking, black-looking ticks. They go out and they can feed on bigger things, like bigger mice, and so they go through these cycles of feeding on different larger size animals. The deer they feed on take them long distances, so distribute them all over your backyard, and then these ticks. Basically what they do is they climb on a piece of grass or a shrub, and they do this really weird behavior called questing. The back legs attach to the leaf of grass, and the back 2 legs attach, and the front 2 legs, these are arachnids type things, they have 8 legs. The front 2 kind of like go up in a praying motion, and then they sense heat and smell, and they wait. Quest. And when an animal passes by, they attach, and then they crawl up the animal, find a nice little spot. In human beings, it's usually the back. It could be in the crevices, it could be in the hairline, and then they find a good spot and they start biting.
Interesting. So these ticks are really out to get you. They're just waiting to latch onto something.
It's a matter of survival for them. That's how they grow up. They go from one stage to the other. Yeah.
Sure. So I guess we can't really blame the ticks. That's just part of nature.
Let's not blame the ticks. No, I blame the ticks. We should squash them. Yeah.
And are there certain times of day when ticks might be more prevalent?
They're there. They're questing in the entire day. So no, not really.
Okay.
Yeah, you may not see them in the dark. So yeah.
Okay.
But they're there. Yeah.
And as far as you mentioned, they might be in the back, but they typically go to like hidden spots, crevices. Like where would you find them on your body?
Oh no, but what they do is they try to find a nice spot to bite, and they generally when they can latch on, they climb up. And so they would be say they were on your shoe or your trouser leg, they would crawl up and they would find under the shirt, and then they would go on the belly. If they climbed up through the sock, they would go into the groin area. So they find a spot and they can't go any further. That's where they'll attach.
And they just latch on. Okay.
In kids, I've seen a few that have latched on to the hairline and ear, because that's the nice plump spot, and then they bite and drink.
Okay. So let's talk about, what someone should do. They feel a tick, they see it on their skin. What should they do? Is there a good way to remove it? What are the steps to take?
It should be removed. It shouldn't be squeezed backwards. You shouldn't squeeze the butt part of it, like the back end of it. With nice tweezers, go near the mouth and then kind of pull it out.
Okay.
And gently, not breaking it.
Okay.
Yeah.
And then after that, should they cleanse the area somehow?
Soap and water is always good.
Okay.
Yeah.
Soap and water. And then do they need to immediately worry, I'm going to get Lyme disease?
So if you look at the tick, take a picture of it.
Mm-hmm.
Take a picture of the tick, try to blow up the picture, go on the internet and look for comparison ticks. There's so many pictures available on the CDC website and others. If it looks like a deer tick, the one that causes Lyme disease, you can theoretically take couple of doses of an antibiotic called doxycycline, and that has a chance of reducing your risk of Lyme disease.
Okay.
Yeah,
So,
bring it down by 70%.
so if they think they've been bit by a deer tick, should they call their primary care doctor?
Primary
should
care
they go
doctor's good.
see you, or they get
Primary care
referred to you
doctor.
if
I'm
needed?
not. I think there are millions of tick bites in these areas.
Yeah.
And yeah, if great, come to me. But seriously, you should just go to any doctor.
Yeah.
It's not an emergency room kind of thing. I wouldn't go to the emergency room. Just call your doctor. You could call, and you can somebody can call in a prescription for this doxycycline.
Okay. So
It's and if you don't get this doxycycline, just keep an eye on yourself. In a week's time, if you're feeling fine, you should be okay.
Right. So don't panic.
Yeah.
Basically,
No,
I
you
mean,
don't have
it's
to
not
panic.
going to be
No.
automatically assumed
Most of
that
the
you're going to get a
ticks
disease.
you're fine on yourself. They haven't transmitted Lyme disease. You found them too early. But if you find a bloated one, or it's like bloody, then, or it's been around for 3 days, you think, then it may have transmitted about to transmit Lyme disease, and that could be the time where you can take a pill.
Okay.
Yeah.
And then at that point in time, you think you have something, you're feeling terrible, the primary care provider would probably refer someone to you for the treatment options?
No,
or?
not. I mean, more business great for me, but in reality, primary care here, they are very good.
Yes.
They will give you the 10 or so days you need to treat this when you get the rash. You don't need a blood test for that. That rash tells you have it. If you go tell your primary care physician you got bit by a tick and you have a fever now, that's Lyme disease probably, or anaplasma, and that requires a doxycycline. Now the third disease, Babesia, it's non-fatal. It'll slowly give you issues over many months and stuff, and if and we can look for it. So if you give the history, oh doc, I was bit by a tick a couple of weeks ago, a month ago, 2 months ago, then we know what to look for, and there's a panel test we can do, and we can come to a diagnosis.
Okay. So most important, don't panic, see how you feel.
Yeah. It
and
doesn't
then,
kill you.
Again, it's treatable.
It's treatable.
Which, again, it's not like the old theory years ago that it's
you don't feel
doom and
great.
gloom if
No.
you get Lyme disease.
You don't feel great, but it's treatable.
Okay, excellent.
It's not COVID. COVID is treatable, but still, it's not COVID.
Of course.
Yeah.
Yep. So I know you did talk about the various treatments. Is there anything else people need to worry about with ticks other than those key diseases?
So if there are new ticks coming to the area, I mean there's been disease here already. I mean there's Rocky Mountain spotted fever, which could be quite serious. It's rarer here,
And you
but
said Rocky Mountain
spotted fever. Yeah,
Okay.
it's like anaplasmosis or Lyme disease, but it's much more. You get a rash, and you get more severely ill. And if it's not treated, often people die. It's not. The name is a misnomer. It's not found in Rocky Mountains specifically. It's found mostly where ticks are on the East Coast and Cape and Island areas. I have seen a few cases in southern Rhode Island, but it is there, and so that's one. The Lone Star tick, the one that is kind of slightly more aggressive and bites more, can transmit another disease which is very similar to anaplasmosis.
Okay.
So there's issues with other ticks.
So prevention is key, obviously, and you'd recommend maybe people, go online, just take a look to see, get familiar with what these types of ticks looks like?
Yes.
Okay.
Yes, absolutely. And one other thing, that these ticks do have other diseases. And there are a couple of other viral diseases that we have no cure for. They can cause a severe meningitis.
Okay.
And there have been fatalities. A couple of them, so not from Lyme disease, but from other things that tick can transmit. So we have to be wary of tick bite.
Okay, sure, and monitoring how you feel after you find one.
That is correct.
That is most important. If there's any progression, you start to feel worse, then that's when you should really seek medical attention,
Yes.
or through your primary care provider, of course.
Yes.
Okay, this has been incredibly helpful information, very eye-opening. It makes you really just be a little bit more cognizant of things that you need to worry about out in nature. Of course, there are so many, but this one is something that we can do a lot of prevention and hopefully not come down with one of these types of diseases. But is there anything else you want our listeners to know?
Well, just by talking to you, I learned a little bit that what I need to do. Find out about Lyme disease in animals, which I think I knew a little bit about, but I need to read up on that. But the second thing is, I think I'm going to get a map of Taunton, and I'm going to blow up that map and put it on the back of my office wall, because I need to figure out, because there is areas here that are wooded. A block away, there's a graveyard that seem to have a lot of Lyme disease. And if we find out where people, like the patient's address tells you whether they have Lyme disease or not.
Interesting. Absolutely. Okay,
Yeah.
well, Dr. Zadie, thank you very, very much. I'm sure our listeners are going to thoroughly enjoy this show. Lots of great tips and information. I learned so much, so we very much appreciate you being here. And again, Dr. Zadie practices over in the Thayer building at the hospital, but also does a lot of, seeing inpatients here at the hospital, and works closely with our base of primary care providers. So as he mentioned, if you'd feel you've been bit by a tick, you're starting to feel lousy, please reach out to your primary care provider so you get the best possible follow-up treatment.
The primary care providers are really good in this area, and most of them have my cell number. So,
Okay,
yeah.
Excellent. All right, well, thank you so much, Dr. Zadie. We really appreciate it.
All right, thank you.
All right, well, another great show. I thoroughly enjoyed it. I learned so much, and I hope you did too. Thanks again to Dr. Zadie for joining us today. Clearly, he is an expert on this topic, and he shared a lot of great tips and education with all of us today. So it is time for a final break of today's show, but when we return, as we often do, we'll just share some hospital updates and some news about upcoming events. So stay with us, and we'll be back again after this short message.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org, and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final part of today's Morton in the Morning show. We hope you have been enjoying today's show, but if you're just tuning in, we have been sitting with Dr. Najum Zadie of our infectious disease team here at Morton Hospital. Our show today was all about ticks and tick season, and he shared a lot of great information. What types of ticks to look for, how to prevent tick bites as best possible in terms of, if you're out and about in the woods, how to cover up. He talked about the short-term and long-term effects of tick bites, including some of the illnesses that ticks can carry that humans can get, such as Lyme disease. And just a lot of great information and helpful tips were shared. So if you missed today's show, but you have an interest in this topic, which you should, of course, because we're right in the middle of tick season, and everybody really should be watching out for those ticks. I know with everything else going on, such as COVID and other things, it might be the last thing we think of, but definitely really important to be cognizant and aware of your surroundings and checking your skin, checking your pets for ticks so that we don't come down with those types of illnesses. So again, if you missed today's show, don't worry, you can still listen to it online. Later this week, we'll post the link on our Facebook page, and you can listen right on YouTube. And to follow us on Facebook, just go to facebook.com/Morton Hospital MA, and you will find a link to this show, as well as links to other past shows, and also all of the latest and greatest happening here at Morton Hospital. So thank you again to Dr. Zadie. As he mentioned earlier in the show, you can go online and find a lot of great information about ticks as well. You can find pictures of what ticks look like and which ones to watch out for. You can also find some tips like the ones he mentioned today on how to best prevent tick bites or ticks from getting on your skin if you are out and about out in the woodsy areas where they often will sit and wait for you to walk by so they can latch onto you. So, but again, as Dr. Zadie mentioned earlier, if you feel you have been bit by a tick and you are starting to not feel so well, reach out to your primary care provider because they can give you the best advice and guidance and refer you to a specialist if they feel that you need to see a specialist at that time. So just a few updates to share as we come to the final minutes of today's show. Last week we did have another nursing and CNA hiring event here at Morton Hospital, an in-person event which we are doing now monthly. So we want to thank everyone out there who maybe even came to the event or referred someone or shared the event with family, friends, neighbors. We had a good turnout, and we were able to hire 8 new team members from that event. So we're very excited. The new team members include nurses, CNAs, which are certified nursing assistants, and MHAs, which are mental health associates, who often work up in our MORCAP unit or in our emergency department. So we had a great event. We'll look forward to hosting another event next month. But if you missed that, if you're looking for a career, you don't have to wait for our hiring events to sign up and apply for a job here at the hospital. We have all of our jobs posted online. That is always up to date. The website is jobs.steward.org. And when you go there, you can narrow down your search by state and then city and click search. Just select Taunton and you'll see our list. We have dozens of great career opportunities here, not just in clinical areas. Certainly we do have plenty of nursing and CNA positions open, but many great opportunities also in non-clinical or ancillary support areas. So take a look, jobs.steward.org, and you can apply online at any time. We are certainly looking to continue growing our team as our services continue to grow for our community. So please, if you know anyone who wants a new career, any great candidates that want to work in the field of healthcare, it's a very rewarding field and we are growing our team. So check it out, jobs.steward.org. And just as we are growing our hospital team right on site here at Morton Hospital, we are also growing our team of providers and staff at our Steward Medical Group offices, and we are happy to have welcomed a brand new provider to our SMG primary care at Northwoods practice. Her name is Caitlin Martin, and she is a nurse practitioner, and she joined that team last week. They are located in the Northwoods Medical Center building right up on Bay Street, and they have a whole team of primary care providers, both internal medicine and family medicine. So they are accepting new patients. If you or anyone you know needs a new primary care provider, you can contact them for an appointment with either Caitlin or another member of that team. Their phone number is 508-822-2266. Again, that's 508-822-2266. And coming up in the coming weeks, we actually also look forward to welcoming another new mid-level provider to our one of our on-site departments here at Morton Hospital. So Erin McDonough is joining our pain clinic here at Morton Hospital, which is located right up in our day surgery center. So she's joining Dr. Levin and Dr. Todoroff in our pain clinic. She is also a nurse practitioner, and we will look forward to Erin starting here in mid-July. And lastly, just a couple shout outs to our staff. So first, we want to thank a few of our team members who attended this week's Taunton Area Chamber of Commerce annual golf tournament fundraiser that was held at Segregated Country Club on Monday. Unfortunately, it was a pretty rainy day, but our team still had a wonderful time supporting the chamber. We were the flag sponsor of that event, and they just had a great time joining other members of different businesses and organizations throughout the community for a fun day of golf, regardless of the rain. And it's all to support the Taunton Area Chamber of Commerce, who is a great partner of ours, and we really love to support all of their events because they do so much great work to support the business community here in Greater Taunton. So shout out to the Chamber for another great event and to our team that attended. We also want to give a shout out to one of our providers. So Dr. Patricia Andrade. She is a general surgeon and a breast surgeon here at Morton Hospital. She's part of our Morton surgical team over in the Thayer building at Morton Hospital. And Dr. Andrade is very active in the Cape Verdean community. She recently just received an incredible honor, and we're very proud of her and want to congratulate her. She was actually chosen as the Grand Marshal for the 50th annual Cape Verdean Recognition Parade. Now that parade happens actually this Saturday, July 2nd in New Bedford. It's part of a whole week's worth of events in celebration of Cape Verdean Recognition Week. So that parade begins at 11 a.m. on Saturday near Buttonwood Park in New Bedford. and our very own Dr. Patricia Andrade will be leading the way as the parade's Grand Marshal. So congratulations to Dr. Andrade on that well-deserved honor. We want to thank her for all that she does, here at the hospital for all of our patients, but also for the Cape Verdean community. Certainly a very deserving honor for her. So congratulations, Dr. Andrade, and we hope that you have a bright and sunny day for your parade this coming Saturday. So that just about wraps up today's show. I again want to give a special thank you to Dr. Zadie, who joined us for today's show, all about ticks and tick season and how to best avoid some of those common tick-borne illnesses. So much great information was shared, and we hope you enjoyed listening. But again, if you missed the show today, you can listen on Facebook. We'll be posting a link later this week. Facebook.com/Morton Hospital MA is where you can find us. And you can listen to all of the great tips that Dr. Zadie shared right online, as the shows are all uploaded to a YouTube page, and we post those links every week. So before we end, just a friendly reminder how you can contact us here at Morton in the Morning. Send us an email anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We would love to hear from our listeners. Give us a shout out, give us any feedback about our shows. What did you like? What didn't you like? Do you have any suggestions for future shows? We want to make sure that we're bringing you topics that you are interested in and that you want to hear about. Again, I think today's show about tick season was really special because it could impact everyone. So we hope everyone enjoyed that. But again, if you have any suggestions, we would love to hear your recommendations for our future shows. So email us mortoninthemorning@steward.org, and we look forward to hearing from you. So thank you so much for listening today. We look forward to joining you again next week. And from all of us at Morton Hospital, we hope you have a happy and healthy week. Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.